Carole Osborne, and I want to talk to you today about the contrasting use of the Oakwork sideline positioning system and the use of pillows to create a comfortable sideline position for any of your clients who might need that. That might be overweight clients, it might be someone who's a little more frail and perhaps has had some surgery or some medical equipment. I use it a lot for pregnant women, and oftentimes there are clients who just feel more comforted, as well as it's a better position for accessing the parts of the body that are needed to be accessed: the hip, the shoulder girdle, the back. So I wanted to show you some of the elements of getting sideline positioning, first with pillows, which is what many of you perhaps are starting out with. And the use of a pillow may be skewed at a slight angle so that it fits underneath the head a little bit. And putting another pillow that would be placed underneath the torso so that there's a little support for the torso so that there's not as much compression of the shoulder when the client lies on their side. And then whatever firm pillows you might have that you can use for a leg support. I like to use a couple of king-size pillowcases and pillows, and that works really well for most people's legs. And then oftentimes what we need to do is we can use maybe our face cradle or some rolled towels, or perhaps we have some additional pillows that we can use for creating a comfortable position here. So I'm wondering, Molly, if you'll come on over and climb onto these nice soft pillows here. You'll be facing out that way, laying on this side. Yeah, and just bring yourself kind of over that pillow. There you go, like that. Good, and I'm going to just adjust that up a little bit under your head. Great. And if you want to take that leg and bring it up here, good. Now you'll notice immediately when you put your leg on these pillows that you're getting the lovely advantage of pillows that they're soft, and the disadvantage of pillows is they're soft. And did you feel how your legs sunk down into that? Which oftentimes will create some strain on your hip and your leg there. So that's when I mentioned that you might need some additional pillows, and you might need to create some greater height by adding more and more pillows. Sometimes those pillows collapse down during the course of your session, and so you may have to adapt for that. I'm putting her foot on the face cradle since we're not using it for something else. So here's a support using basically just pillows. So contrasting that, I want to show you what we were able to design with the sideline positioning system. And so what we have now is a very firm torso cushion here that has some areas carved out for breast recesses. It's firm, but yet it collapses right here in the center into some memory foam that really cradles the client's body on their side. And there's a nice gap of space for the shoulder girdle to go into, and a firm headrest that has an area cut out here that can be placed over the shoulder and underneath the cervical spine and creates a really lovely support here. There's a really dense bolster for the leg, which tends to stay nice and firm as the leg is on. And then there's a pillow case that we've put in a regular pillow in here that can be used for some additional height here or for the arm. A nice little wedge for adjusting anything. And I'll show you when I get Molly on this sideline system how that's like. So Molly, let me just get this a little bit out of your way so that it's easier for you. And if you'll just go ahead and push up, there you go. And you'll be facing the other direction here. Good. Climbing on. And then, yeah, bring yourself up into that space. And go ahead and move your bottom just a little bit towards the front of the table. Just your bottom. No, not towards me. There you go. Beautiful. See, I got her right into the center here so we could take advantage of the firm foam that's on the edge here, and then have her in this softer space here. Here's lots of room for her shoulder. And I don't know if you noticed, but there was a tremendous amount more collapse here in the shoulder girdle when she was laying on the pillows. And now you have less pressure on your shoulder on this side, right? And watch what happens when I get this adjusted a little bit better under your head and neck. You'll probably feel that easing even a little bit more under there. Great. Okay, so let's get your legs set up here. So go ahead, and if you want to bring your leg up here, that's lovely. And once again, a face cradle for a handy dandy little foot support here. And if we needed this under your belly, we could use it there. I think I remember that you like it right under there, don't you? So I find that I get a very firm but very soft and comfortable position using the sideline system, particularly when I make sure that I have the client positioned exactly in the center of the system and have the benefit of the designs of the head support and have the leg aligned here. So I hope that will help you to see why you might want a sideline positioning system and how you might use pillows if those are what you're going to be using for your sideline clients. Thank you.